You're watching Brain Health by Dr. LaSalle on Resonance Wellness TV, part of our Whole Life Medicine Alleviate series. Keep in the loop about future webinars and events on whole-life-medicine.com. Hello and welcome to this webinar on brain health. My name is Dr. LaSalle and I will be your guide today about all things brainy. And as usual, this presentation is given in the context of the whole life medicine model. And when we talk about brain health, we're talking about starting points in both alleviate and align in the whole life medicine model. We also could potentially talk about some problem-specific programs, although we're not going to talk about any specific protocols for specific diseases per se today, but we will talk a little bit about pretty much a good overview of many of these processes in both alleviate and align. And we're going to talk about brain function and brain diseases and the different things that can adversely affect your brain. So we're going to be looking at multiple areas where we can decrease damage and improve brain function. And in this lecture, we're really going to explore some things that you might not have a lot of background for. But in the end, I think you're going to find many of the lectures we've already gone through in the past year are going to share common threads with this one. And I'm hoping that that actually is starting to become more clear with time, is that how interrelational so many of our health concerns really are. Now, many of you might not know this about me, but my undergrad is a BSc with psych specialization in neuroscience. And I am quite fascinated by brains. I was really excited to learn about the brain after an interesting start in my undergrad in the study of drugs. And yes, I did start out studying drugs. And what was crazy to me was I came out of my undergrad really understanding that plants were our most powerful drugs. And I also came out of my neuroscience degree understanding that consciousness wasn't really a byproduct of brain function. And so both plants and the nature of consciousness are really still at the forefront of my interests and my drive to help my patient community. But we're going to start somewhere today, and that won't be the complete synthesis of all of those ideas, but we're going to just start with asking what is the brain? And really, this is the most interesting question. The brain has been described as a computer, and in some ways that's true, but the truth is likely substantially more complex than that. It is so complex in the sense that this organ is really involved in mental intelligence, interpretation from the sense organs of your body, body movement, behavioral responses. And the brain weighs about 3 pounds for the average adult. That makes up about 2% of our body weight. And men's brains are slightly bigger, but that doesn't make them any smarter. Just so you know, we actually do tend to have different ways of using our brains between sexes. Men have more back to front connections in the brain and women more side to side. It's probably due to cultural differences, though, and what activities are cultivated in the different sexes over time. The brain contains about 100 billion cells. That's a set of cells that's really capable of about 100 trillion connections. It can even generate enough electricity to power a light bulb by itself. The speed of some of the signals in your brain are up to 268 miles per hour. It's absolutely blinding speed. In the context of the distance in a body, it's almost instantaneous. It can store about 300 million hours of TV, according to Scientific American. I came across that statistic and I thought, oh my God, that's great. So you have like a really serious hard drive technically in there. But the brain is about 75% water by weight. And of the other 25% by weight, 60% is fat. So often you might have heard me say in clinic, basically your brain is water and salt with some fat floating in it. I mean, there's proteins in it, obviously. There's 40% of the other 25% is proteins. But it just gives you an astonishing sense of how it's how juicy it is. And we're going to see a picture of a brain in a second, and I think that's going to show you a little bit about juiciness. Now, the brain is mainly fueled by glucose, although you can use other fuels for it. You can use ketones. And the brain has kind of two obvious colors that you may have heard of, gray matter and white matter. And the gray matter is actually the cell bodies of neurons, and the white is the axons of the nerve cell, covered by myelin sheath cells, which appear white. I'm trying to think if, I'm pretty sure I have a picture of this in just a moment, so bear with me. Now, another big myth about the brain is that we only use 10% of our brains, but the truth is we actually use 100% of our brains all the time. Brains are very active even during sleep, mostly because the brain has to clear out waste in the night, just like most of your organs do. And humans are not the mammals with the biggest brains. Sperm whales have brains 5 times the size, just so we're clear. We're not the brainiest by size. Now, there's several ways to look at brain anatomy. And depending on what you're researching, if you're a researcher, you might make use of any or all of the systems of looking at the brain. And right now, we're just basically going to whip through neuroanatomy at the speed of light and hopefully just create a little background for you in the study of brain health, because some of the things that I'm going to be referring to are anatomical in nature, and it'll help if you just have a little backgrounder here. So bear with me. There's definitely a test at the end. Just kidding. There's no test. I would never test you. Although we could do it as a memory test. Just check that out. So in this illustration, we're seeing the brain showing 3 major divisions in the bigger picture. And then you can see on the right-hand side there, I've stuck another picture that has 6 sections, or 6 major divisions. And not all of them are written down there. So we're just going to go through this quickly so that you have a sense of things. So in the 3 major divisions, we can divide the brain into the forebrain and the midbrain and hindbrain. So the forebrain is obviously the biggest section here, and it's the most developed part of the human brain, and it houses really the cerebral hemispheres. So those are the kind of wrinkly things that you see at the top. The midbrain is housing the uppermost part of the brain stem. So this blue section here that looks kind of like a staff, that's your brain stem. And you also have your hindbrain, which is the upper part of the spinal cord, the brainstem, the rest of the brainstem, and the tissue that's called the cerebellum. Often people have heard of the cerebellum before. So on the right, this small diagram is showing the divisions in the central nervous system that are as they're related to embryological development. So a lot of the study of the brain has really been done to compare species and to compare their development over time. So these divisions are really based on how the brain is developing, and they're used to study the differences between how developed each of the brain regions is in different species. So this is a human brain illustration. So you can see that the forebrain is really large. The forebrain is basically the brain at the front left of the yellow section here. So the cerebellum is towards the back of your head, and the forebrain is in the front. And you can see that this is the part of the brain that's increasing the capacity for the intellect. So if you look at an animal brain, you'll often notice features on it that indicate a particular strength. So like, as an example, dogs will have over-accentuated olfactory processing areas. Not big cerebral hemispheres, not as big as yours, but way represented in like the cranial nerve that goes to the nose, and also the sections of brain that process that information. So you have exactly the same components typically. They're just not as big. So what you're seeing, the differences between animal to animal, is really the relative size and relative connections in each of the brains. But most people's brains, if you compare brain species to humans, you'll see all the common features. But it's a kind of an interesting study to see developmentally which things are accentuated in different animals. Now, the cerebrum is divided into 4 lobes, frontal, parietal, temporal, and occipital. We're going to see that represented again here in a second. Many people have heard of those terms. So the frontal is the 2 lobes that are right at the front of your head. The parietal is if you were to kind of put your hands on the top on either side, kind of above where your ears are. Those are the parietal lobes. Temporal is above your ears, and then occipital, which is the very back. And so the brainstem has its own divisions. It has the midbrain, pons, and medulla represented in it. And the cerebellum, as you can see, is tucked behind in the back of this cerebrum, but it's very much attached to the back of the brainstem here. And between the cerebrum and the brainstem, this is not really very well labeled, but you can see that that little dot that's above the pink center there. So that's the place where your thalamus and hypothalamus are. It's in that area, just above that pink zone there. Now, this is going to be a cool but slightly gross picture. So this is a brain that's fresh. And I thought you'd like to see this for a couple of reasons. First of all, you're seeing this in the same orientation. So the forebrain is at the left. And you can see here the gray matter and the white matter. So this is a fresh brain without preservation. If you preserve a brain, actually, if you preserve pretty much anything in the body, it basically looks like chicken. It's like the same colors. There's not a lot of distinguishing. It's hard to tell the difference between an artery and vein because honestly, in a cadaver, they're not colored. The only thing that's really brilliantly colored in a body is often the gallbladder. It'll turn bright emerald green in a person. It's kind of cool. But most other things, there's not a lot. And so here you can see how many blood vessels are feeding the brain from the outside. And then obviously you can see the distinct colors of the gray and white matter. So the gray matter basically is all the cell bodies of your nerves. So a neuron is a very long, skinny cell. And it's kind of like a ball with long fibrils coming out of it. Now, there are different kinds of nerve cells and they have different looks to them, but I'm just going to give you kind of the stereotypical neuron looks like that. And so the long tails, which are the communication pathways, are the white matter. So here what you're seeing is the cell bodies are all towards the outside of your brain, and then the pathways all run like a group of cable wires as the white matter through and across and connecting different places and then down into eventually into your spinal cord. Some of them will go all the way down there. Now, what I also want you to note about this picture is that's the cerebellum on the back there that you can see poking out. And everything is just kind of very smooshy. And I want you to just kind of see, it's like kind of just smushy. And it's obviously laying here on a stainless steel tray, but it's very gelatinous, your brain. And I remember back when I was doing rat brain surgeries in neuroscience, how interesting that was. The texture of it is actually quite soft. And it also doesn't have really any of its own pain neurons. So you can do brain surgery. The anesthesia is not for the actual brain surgery. The anesthesia is for cutting through the skull and the scalp. Now, the brain is organized into areas that have certain functions. And like I said, I was telling you about the lobes before. Here you can see the lobes are colored. I've just put an overlay on here. So the frontal lobes are red, and then the parietal are yellow. The occipital is green, and the temporal are blue. And you can see this cerebellum tucked underneath here is a kind of pinkish color. So the frontal lobe is part of the holding of memories, and that allows you to plan and imagine and think. And the parietal lobe translates the senses, so touch, vision, hearing, and as well as speech and reasoning and emotions. And it's quite important for spatial orientation and navigation. The temporal lobe, which is right above your ear, logically processes sound and language. It also houses the hippocampus and the amygdala. And those are two things you're going to hear me talk about later. They play roles in memory and emotion, respectively. And the occipital lobe is responsible for visual processing. Now, that one's a little counterintuitive because you think it'd be closer to the eyeballs, but it's not. It's actually a pathway that runs kind of underneath the brain and into the back. Now, the brainstem, which we saw before, is really something that relays information between the brain and the rest of the body. And your autonomic functions like breathing and heart rate and body temperature are really controlled in the brainstem. So this is one of the reasons why if somebody has an injury to the brain that causes a great deal of swelling, the risk is that you're actually going to herniate the brainstem through the skull hole, like the hole through which your spinal cord normally passes, kind of like you swell it up inside the skull, which is of course a closed space, and it actually forces a lot of pressure on the brainstem, and you can see people will die because they can't maintain those very, very basic functions. Now, the cerebellum is something that coordinates muscle movements. So it coordinates it. It's not all of it. It has a lot of connections with your parietal and frontal lobes because there's motor and sensory function coming from there. But it's predominantly used to maintain posture and balance and kind of some of the repetitive aspects of coordinated muscle movements. So muscle, what we might call muscle memory or movement memory. Now the thalamus, which is on the inside, you can't see that very well in this particular picture, relays sensory and motor signals to the cortex from the rest of the body, and it's involved in regulating consciousness and sleep and alertness. And the hypothalamus, which is just underneath the thalamus, connects the nervous system to the endocrine system, so where hormones are produced in the pituitary gland. So here we start to already see the crossover of neurology and endocrinology, which is the study of hormones. Now, the cerebral cortex is where most information is actually processed in your brain. It's those cell bodies. It's that gray matter I was showing you before. And again, if you didn't figure it out by now, this part of the lecture is a memory test. I'm sure we can come back and you can tell me all of those things right back again. But I just want you to get a sense of it. I don't want you to memorize it. I just want to give you a sense of like where those structures are while we're talking about some of these other things that we're going to talk about. So let's just take a quick look at the left brain versus the right brain. So you might already know the human brain's divided into the left and right hemispheres, and they're actually connected by a very large bundle of about 200 million nerve fibers that goes from side to side called the corpus callosum. And I wanted to share with you, I don't know if you've ever seen the TED Talk that Jill Bolt Taylor did about having a stroke on her left-hand side in 2008. It's a TED Talk that's called My Stroke of Insight. If you've seen this or you've seen her subsequent book about her experience, I think it's the same name. Jill is actually a neuroscientist. And when she personally experienced a stroke, she had really amazing insights about brain function based on her experience of the left brain basically coming offline. She had a hemorrhagic stroke the size of a golf ball that had to be removed from her head. It took her quite some time to recuperate from that. But what was interesting about it is she had the experience of mostly listening to her right brain. Now, there really isn't such a thing as a left brain person or a right brain person, just so you know. Like, nobody only functions on one side. You might think your husband is only left brained and that you're the right brain person, but really you do have usually a pretty good capacity to access both. But there are differences in which parts are emphasized in a certain person, and that could sure have an impact on skills and apparent personality. And the original theories that surrounded left-right brain dominance that stated that each side controlled different thinking styles, that actually won Roger Sperry the Nobel Prize in 1981. It was the left-right brain theory. Now, there are definitely functions that are sided. Each side of the brain controls the opposite side of the body, for example. So the left brain controls all the muscles on the right side of the body and vice versa. So this is a little bit interesting because here we start to see the information that crosses over from one side to the other. There's a lot of that in neurological connection in the brain. And so, I mean, we've all heard about the left brain as, left brain thinkers are supposed to be more logical and analytic and objective. But really what the left brain is in many ways, and this is how Dr. Taylor, who had the stroke, describes it, is she describes it as a serial processor. So it does think linearly and methodically. It's very much about the past and the future. It's designed to pick out details and categorize and organize that information with all you've ever learned in the past. It thinks in language. It connects the inside to the outside. She feels it's the voice of the I am and of being a separate individual. So most people have their language centers on the left-hand side. About 97% of people do. So not 100% of people have their language centers on the left. It's usually, like I said, logical and critical thinking. Your sense of numbers is on the left-hand side. Your capacity to read visually is on the left-hand side, and a certain degree of your reasoning. Whereas your right brain is more spatial. It's more visual and artistic abilities. It's more of a parallel processor. So it thinks in pictures. It learns kinesthetically. There's this kind of present moment awareness. So what it feels and sounds and smells like right now in this moment. And right brain thinkers are said to be more intuitive and thoughtful and subjective. And certainly, like I said, people can definitely have more skills on that side. It's also the thing that helps you recognize faces and emotional expression, music, reading, interpretation, color, imagination, intuition, and creativity. So what's fascinating about this is that when she did have her stroke and she became way more right-brained, like for the window of time after and for much of her recuperation, she really concluded that we can choose to have the experiences of either the left or the right side of the brain. And most people are very left-sided. We have a culture that's very left brain dominant because we really encourage those skill sets. But it doesn't mean that the other side of the brain's experiences can't be cultivated and accessed. And because she learned that when you choose the right side, you actually create a lot more peace in yourself. And if lots of people do that, you actually create more peace amongst people. And I'm quite excited about her findings because she's really describing a number of peak human experiences that have been spoken about in the consciousness community. And we're going to have a lecture about that later. That is a whole different subject, the subject of consciousness. But we're learning interesting things about the brain over time and slowly piecing together what it can and can't do. So, why is brain health so important? A healthy brain really should function quickly and automatically. And unfortunately, the number of people suffering from a neurological disorder, so a disease of the brain or spine or nerves connecting them, is really increasing a lot over time. And so in the US, the National Institute of Neurological Disorders reports pretty much all of these as common disorders. So neurogenetic diseases like Huntington's disease and muscular dystrophy, developmental disorders like cerebral palsy, degenerative diseases that happen in adult life like Parkinsonism and Alzheimer's disease, metabolic disease like Gaucher's disease, cerebral vascular diseases like stroke and vascular dementia, trauma, such as spinal cord and head injury, convulsive disorders like epilepsy, infectious diseases like a dementia that can be caused by an infectious agent like AIDS dementia is an example of that, and brain tumors. So we're going to take a deeper look today into a few of the neurological disorders that have the biggest impacts on brain health. And of course, the thing that people think of first usually is dementia. So dementia is the loss of mental functions that affect daily activities. So dementia is not a specific disease. It's usually the result of another disease process or injury to the brain. So it can be caused by neurodegenerative diseases that are affecting brain neurons. It can be produced by vascular diseases that are affecting blood vessels like arteries and veins, and head injury. Those are probably three of the biggest categories. And dementia really describes a very wide range of symptoms. So for a condition to be considered dementia, you pretty much have to have at least two of the following things significantly impaired: memory, communication and language skills, the ability to focus or pay attention, the ability to reason or produce judgments appropriately on that reasoning, and visual perception. So dementia is not a normal part of aging. It's caused by brain cell damage. So in essence, you're damaging enough cells to impair communication in the brain. And so that's going to create the symptoms that we're talking about. And many forms of dementia are progressive. So that means that symptoms are getting worse as time goes by. And there are a number of prevention strategies, I think, that we can identify as helpful for reducing risk. And we're going to be discussing these in more detail in just a moment. But I wanted to give you a sense of what the statistics are like in Canada for dementia. You can see this is a significant issue. And this is like just from about 4 or 5 years ago. So this is national data showing that over the age of 65, there are 432,000 seniors with diagnosed dementia as of 5 years ago. 2/3 of them are women. And I know lots of you, even on the call today, are women. Not everybody, but this is a big risk in women. The percentage of seniors that are living with dementia has increased by 9% in the 10 years that they measured. You see that translates into 9 seniors being diagnosed with dementia every hour. And the risk of being diagnosed with dementia is doubling with every 5-year increase in age between 65 and 84. And this is a significant cause of mortality. So the all-cause mortality rate, that means that all of the causes for which you would die in seniors with diagnosed dementia is almost 4.5 times higher than seniors without dementia. So these are sobering statistics. Obviously, a lot of people have had relatives, parents, grandparents that have suffered with dementia. And one of the interesting things that I find about dementia is there's a kind of feeling of it being inevitable. And warning signs of dementia are often ignored, especially by the person who's suffering them, even if they're aware of it. You know, I often found that if people really start to think they're getting dementia, that there's normally something else that's explaining it, and it isn't like a true brain degenerative dementia, although sometimes people do pick it up themselves. But there's a kind of interesting sort of denial in it. And there's often denial in people who are close because it's a hard thing to think about. So one of the most common forms of dementia is Alzheimer's. And so Alzheimer's is a degenerative disease. It is the most common form, and it's causing problems with memory and thinking and behavior. It's accounting for about 45% of Canadians that are put into care facilities for a neurological problem. So that's a pretty good chunk of people who need really significant care. There's probably about 750,000 Canadians living with dementia. That's kind of a ballpark figure. The feeling is that 1 in 10 people over the age of 65 will have Alzheimer's. It affects about 44 million people worldwide. I mean, basically, that's the population of Canada. So we've basically got a country's worth of people with impaired brain function. It's an astonishing, again, and sobering number. And it's quite difficult to have exact numbers about who has Alzheimer's currently because, I mean, the diagnosis is a bit complex, and really it can only be confirmed post-mortem by brain biopsy. There's definitely certain characteristic features of it, but nobody can say for sure unless they see the actual brain tissue. But by the end of a life that you have lived with Alzheimer's, you could lose a fair amount of brain mass. And here's a picture I've just showing you. On the left-hand side is a healthy brain, On the right-hand side is the brain of a known Alzheimer's patient. So what you can see is you're losing connections, you're losing mass. There's a lot of shrinkage, basically, of brain tissue there. And minor changes in your brain will occur a long time before symptoms will show. And that's because, in essence, it's a problem with two proteins in nerve cells. One is at the synapse, and one is on the communication system within the neuron. So the synapse, I'm going to show you a picture of that, actually. Let's show you a synapse. So what you're looking at here is exploded a little bit. So obviously in the brain, you could see in the pictures that everything is packed very, very closely together. But for illustrative purposes, we're basically looking at these nerve cells quite far away from each other. So what you see in this little tiny box, tiny rectangular white box, is a connection with one nerve to another. And that's what's called the synapse. And so it's the gap in between the two cells, because they're not physically connected. There is actually a space between them. And in that synapse, you're going to communicate from one side to the other by dumping out neurotransmitter molecules. So you can see here that there's a group of little yellow balls that are floating across the synapse and having an impact on the receptors on the other side. And what you can also see on this slide is the neurotransmitter vesicles on the top are coming down off of these little purplish looking rays. And those are microtubules. Again, they're, for illustrative purposes, they're very oversimplified here. There's a lot more crammed into the end of a neuron than you would think. And so what happens is that when neurotransmitters are produced, you produce a protein that's called amyloid beta, and it comes out with the neurotransmitters. Nobody actually knows why this protein is produced. We just know that it appears when neurotransmitters are produced. And in Alzheimer's disease, we're talking specifically mostly about synaptic clefts that are using acetylcholine. That's a specific neurotransmitter. Now, there are supposed to be cells that wander, you can't see them in this illustration, but they're kind of like a kind of cell that surrounds and supports neurons. They're kind of a janitor cell, and they should come into this space and clean the beta amyloid up. But if there's too much beta amyloid accumulated in the synapse, the glial cells, the janitor cells, become a little hyper-responsive, and they start making these hyperinflammatory symptoms, and they start to affect this receptor end, the synaptic end plate. So basically, you're terminating the connection between these neurons because you're actually doing damage to both the secreting and the receptor sides. And there's another protein on the inside of the synapse that's associated with those purple rays that are carrying the neurotransmitter molecules. And they are a type of stabilizing protein called tau. And they're attached to microtubules. So the microtubules are like transport highways in the cell. So here you can see the neurotransmitter vesicles are kind of being brought by the microtubules. Now, if they get tangly, for some reason, these proteins start to tangle. They make a twisted version of themselves that's really not functional. And so the microtubules start to degenerate. So within the axon itself, within the nerve cell itself, you stop being able to transport things. So you're not transporting wastes out, you're not transporting neurotransmitters properly. So you get toxic in your brain and you can't use the communication system properly. Now, Alzheimer's disease symptomatically takes about 15 to 20 years of beta amyloid protein accumulation in tau tangles before you would notice a difference. Now, there are gene risk factors, there are genetic risk factors that include a mutation that increases the amount of beta amyloid that you would get. People have often heard of this. It's called ApoE4. This is related also to your fatty acid metabolism, and it increases amyloid, but it's like any other genetic susceptibility. Just because you have that gene doesn't mean you're going to have Alzheimer's. You can actually be homozygous for this gene and not have Alzheimer's, even though you're technically at a higher risk for it. So let's just talk about lifestyle factors in Alzheimer's, because, I mean, the genes are what they are. But prevention is really the best cure in Alzheimer's and other memory conditions, as we're going to see. So the way that we live really changes your production of amyloid beta. So if you overconsume a lot of fat or a lot of carbs, it really appears to be at the heart of the Alzheimer's epidemic. Then the thought is that the beta amyloid may actually interfere with your brain's use of glucose, which is its main fuel. So the risk of Alzheimer's is doubled in type 2 diabetics. And some in the medical community are actually naming Alzheimer's as diabetes type 3. There's a fair amount of research about this. So it's strongly associating poor lifestyle factors with the development of dementia. Now, cardiovascular disease also increases your risk of dementia and Alzheimer's because arterial stiffness is associated with the buildup of this beta amyloid plaque. And it's probably because you're just not removing wastes as well. So the circulation is basically impaired both ways, nutrients in and wastes out. As many as 80% of people with Alzheimer's at autopsy also have this kind of cardiovascular disease. So hypertension and smoking, both of which are independent risk factors of this kind of change, are really implicated in Alzheimer's as well. Now, exercise decreases beta amyloid, and we're going to see shortly what exercise does in terms of risk factors in a moment. I also want to just note that in slow wave sleep, which is deep sleep, metabolic waste is cleared from the brain. It's like a deep cleanse for the brain. So poor sleep hygiene can be a predictor of Alzheimer's, and it is a positive feedback loop where the worse the Alzheimer's gets, the worse the sleep gets. So it doesn't work well overall. So a great deal of prevention is going to be achieved by maintaining what we would call neuroplasticity or cognitive reserve. The average brain has 100 trillion synapses. Every time we learn something new, we're increasing synapse numbers. So the Nun study, and I'm calling it the Nun study. I actually think it was called the Nun study. And it did study nuns from the Catholic Church between 1986, and it was published in 2003. It actually showed that many of the nuns had increased their cognitive reserve enough so that even though their brains had the features of Alzheimer's disease, they were asymptomatic. So the increased reserve created more functional synapses, and increased education creates an abundance of backup connections, and it buffers you from symptoms. And it buffered the nuns from symptoms, even if their brains were full of those amyloid tangles or amyloid proteins and tau tangles. So you can be resilient if you can access new pathways. So that's not the same as doing crossword puzzles. You actually have to pave new neural roads. So, like meet new friends and read a new book, learn a new language. I mean, in essence, if you can be curious about the world and new things, it will help you. And this is a really interesting picture. I'm hoping that will stick in your brain. And we're going to talk about this again in a second, but we're just going to take another look through a couple of other reasons why you could have brain problems. Now, another major issue with brains is the result of stroke. And of course, we've already mentioned stroke in this lecture already. It's when an obstruction of blood flow is occurring to the brain, and it causes brain cells to die pretty much from lack of oxygen and fuel. So there's three kinds of stroke. The first is where there's a clot that obstructs a blood vessel in the brain. That's an ischemic stroke, and that's about 87% of strokes. The second is where a blood vessel actually bursts. So it bleeds and then it puts pressure on the brain cells because there's limited space in the cranium because it's a bony cavity with very limited space. And the third is a transient ischemic attack. So that's where the duration of the stroke that is like very short. It usually lasts about 5 minutes or less. So the effects of the stroke are dependent on what part of the brain the circulation has been affected in and for how long. So the effect of a stroke on brain function is obviously sudden, and it's continuing over days if people don't seek help for symptoms. The story I told you earlier about Dr. Taylor and her stroke was actually more complicated because she didn't seek help very quickly. She'd actually woken up with a massive headache, tried to exercise through it, and then spent an hour trying to read enough to call her office. She couldn't figure out how to call for help, and she actually had done quite a bit of her morning routine before really getting to the point where she was not able to communicate well. It took her, she said, 45 minutes to figure out how to match numbers from the phone to a business card that she knew intuitively belonged to her office. She couldn't read it, but she could match the things, and she kind of intellectually knew a phone number, you put the numbers in, but she couldn't actually read the numbers. She was just using them kind of like, oh, this symbol looks like this, put this one next. So you don't want to do that. And the warning signs of a stroke are like a sudden severe headache with no known cause. And we're talking sudden severe. It's not like another headache like you normally have. It's quite marked. And then sudden numbness or weakness in your face or arm or leg, especially on one side of the body, because again, the brain has a sidedness. So if you suddenly have numbness on both sides of your, like both arms, that's way less likely to be a stroke. I mean, it could be, but most people will have it more one-sided. You could suddenly have confusion or have trouble speaking or like I said, difficulty understanding speech. You could have sudden trouble seeing in one eye or both eyes, or trouble walking, a dizziness, a marked loss of balance, or lack of coordination. I remember when my grandfather years ago had a stroke, and when he sat down, because we were talking about it, he finally told me he had a stroke, and he was describing how he felt like a fish, like where his mouth was kind of opening up and, and closing, kind of like that fish does that face when it opens and closes its mouth. And he goes, and no sound was coming out. So I just kind of like a fish with my mouth opening and closing. And it was funny because, of course, his description of it was, he obviously survived enough to tell me the tale, but it often would feel something like that. So if you have a stroke on your right side, you might get paralysis on your left side. You probably get vision problems, memory loss. On the left side, the paralysis will be on the right side of the body, and you can have more speech and language problems because remember, most of your language functions on the left. And so stroke is really the leading cause of adult disability in Canada. It's a third leading cause of death. So there's 14,000 Canadians that die from stroke every year. In Canada, there's probably 50,000 new strokes in total. That's a stroke every 10 minutes in this country. And there's 300,000 people who have survived the stroke and are living with the effects of that. And like I said, it varies a lot depending on the severity. We spend probably about $3.6 billion a year in physician services and hospital costs and lost wages and decreased productivity just per year in Canada. So out of every 100 people who have a stroke, 15 of them will die. 40 will have moderate to severe impairment. 10 are so severely disabled they require long-term care. 25% will recover with a minor impairment, and 10 will recover completely. And sometimes that's also about reserve and age and what caused it originally. So the risk factors you can control with stroke are things like high blood pressure. That's about 35% of stroke risk conservatively. There's about 20% of Canadians that have a high enough blood pressure to be a stroke risk. And it goes kind of up depending on what that top number looks like. There's not a huge link between high cholesterol and stroke. It's not really that clear. Obviously, we've talked about that in the past in terms of inflammatory risk. Atrial fibrillation is actually a marked risk factor for stroke. About 15% of stroke patients have atrial fibrillation. That's different than palpitations, incidentally. Atrial fibrillation is really where there's a functional conduction problem in your heart, and the electrical signals to your heart are not normal. Diabetics, 2 to 3 more times likely to develop stroke, and about 20% of the people who have a stroke are already diabetic. Drug abuse, so in younger people, using cocaine or crack cocaine can cause a stroke. Basically what those drugs do is they narrow the blood vessels, so there's less blood flow to the brain, and you can actually starve it. So cocaine also affects the heart. You can get an abnormal heart rhythm. You can get a blood clot as a consequence of that. And like I said, it's in a younger population. You're usually seeing strokes caused by drug abuse. Central obesity is a risk factor. So men with a waist circumference of 40 inches or more, women 35 or more, they're at a particular high risk of stroke. And then, the normal things, physical inactivity, too much alcohol. Although the direct link to stroke isn't clear, if you have excessive alcohol consumption, it's negatively linked. And we've already talked about smoking, diet, sleep apnea increases your risk of stroke from about 1.5 to maybe almost 3 times the risk. And there's a higher incidence of sleep apnea also after a stroke. So, you can kind of start to get a bit of a circle going there. And there's also a growing body of research that show a link between stress and stroke. So stress is linked with stroke risk factors, also obviously like high blood pressure and smoking and overweight. But research is really showing that depression is increasing the death rate from stroke. Now let's take a look at some preventative strategies here. So I just wanted to, as a parent or a grandparent, obviously you want what's best for your child or grandchild. And I'll tell you, there's a couple of major things here that we can control that will help decrease likelihood of neurological problems over time. One thing, and I don't know, sometimes you have control over this and sometimes you don't. Sometimes you're just a bystander, but adverse childhood events actually create problems in neurological function in the long run. There was a study that was that actually showed that if you had experienced more than 3 adverse events in childhood, even if they controlled for lots of other risk factors like socioeconomic status, the risk of dementia would double in those with more than 3 adverse events in childhood. So an adverse event would be things like parental loss or divorce, parental mental illness or family violence, abuse or neglect of all kinds, if it's physical or psychological. If you have more than 3 of those adverse events, it really does increase your risk of dementia, which is very interesting. Also, safety equipment and head injury. The best data are showing that moderate and severe traumatic brain injuries really increase the risk of dementia 2 to 4-fold. It's kind of less clear whether or not like the mild concussion increases dementia risk, in part because the mild head injury is not usually well documented, especially, over the period of time from the childhood to the senior years. But if you look at like veterans of war, there's been studies that have shown that if you've sustained a severe traumatic brain injury, so that's where you actually have lost consciousness or you have amnesia lasting longer than 24 hours, you're 4 times more likely to have dementia compared with controls. So you don't have an increased risk if you have just a mild TBI. Again, we didn't really see this in this veteran study either, but it gives you a sense of like head injury can be really important. And, if we're putting kids in contact sports without sufficient equipment or we're not letting them recuperate properly from injury, it could certainly increase their risk. And so we see that obviously in the high risk sports, boxing, other full contact sports, hockey, even soccer heading shows a risk. They've showed that there's a 5-fold increase in the risk of Alzheimer's, a 4-fold increase in motor neuron disease, and a 2-fold increased risk in Parkinsonism if you have had just played soccer. Like this is, and used your head, they do heading, and there's some discussion that you should probably not let children under the age of 12 head the ball. There's also a positive association between pesticide exposure and things like Alzheimer's disease. It's definitely a risk factor. And of course, you can encourage your kids and your grandkids to eat organic produce, drinking lots of water to remove toxins, and being careful about heavily processed foods. Also using natural cleaners around the house is a good idea. Being careful about flame retardants. We did a huge lecture on environmental toxins last year, and if you missed that, you might want to go back and just take another look at that. Also look for a holistic dentist. There's definitely correlations between heavy metals and the development of dementia syndromes long term. And of course with kids, put them outside, make them exercise, clean things up. And we're going to see that in a second here because we're going to talk about that. So if we look at adult prevention, we basically there's lots of lifestyle things here that can really be preventative strategies. So we can break them down kind of into 4 categories. We can talk about physical health and exercise. We can talk about diet and nutrition. We can talk about cognitive activity and social engagements. So these are the categories that, generally speaking, help keep your body and brain healthy and potentially reduce your risk of cognitive declines. So let's start with exercise. So there's this great lecture by Wendy Suzuki. She is a PhD who does great research about exercise and brain health. And what she found was that physical activity has a very powerful, immediate, and long-lasting benefit for your brain, and it can actually last the rest of your life. It's one of the most transformative things you can actually do for your brain. And part of the reason for that is there's two key areas. The prefrontal cortex, which in this picture on the left here you can see is in green. That's a lot of your personality traits. And the hippocampus, which is this little blue thing a little ways away from the green thing. It's very highly technical neuroanatomy. So these, in learning and memory, these are the two parts of the brain that are most likely to be involved by all sorts of brain disorders. So if you exercise, the immediate effect on your brain is that it increases neurotransmitters pretty much immediately. So a single workout can improve your focus and attention for at least a couple of hours. It already improves your reaction time. Long term, if you change your cardiovascular function, you actually change the brain structure with exercise. So the hippocampus produces brand new brain cells that'll improve memory, improved attention with your prefrontal function, and you're going to create long-lasting improved mood. There's also protective effects on your brain. So like a muscle, the bigger and stronger that your prefrontal cortex and hippocampus get with more circulation and more exercise, the more protected you are. Because again, those two areas are most likely to be affected by neurodegeneration. So the minimum amount of exercise, this is probably your next question, that you have to get is about 3 to 4 times a week, a minimum of 30 minutes. And it just has to be exercise that gets your heart rate up. You know, it doesn't have to be climbing mountains. You don't have to sweat buckets, but, you know, take the stairs, clean the house in a rush, walk briskly. These things all work. And why do they work? Because you're really improving circulation. So you just want to try and find time for this, and you've got to incorporate it in your routine. If you're not doing a great job at exercising right now, just look at the organization of your day and find ways to do it. You know, obviously during the pandemic, everybody is, I think, kind of conversely, if you had already the exercise bug, people did more of it. And if you didn't have it, you did, seems like you did less of it. But I think one of the best things about what's going on right now is I see so many more people outside, like scads of people outside trying to be active. And the other thing that you can do is really challenge your brain with education. So learning new things like we talked about before. Topics for learning are endless. It doesn't even need to be anything, you know, serious. Just pick anything of interest. And now, obviously, we can do lots of online classes about it. Or, you know, those of you that are on this call right now are actually developing neurons as we speak, because you might be learning things that you've never heard before. And the instant that you do that, you're going to actually create some amazing things. And there's online groups now, you know, like Skillshare. You can get thousands of classes on that. You can do some sort of like local online ones as well. Read new books on cooking or making things. Teach yourself to do something physical like sew or knit or crochet. Obviously, we're a bit limited in the social category in this last little while, but you can always find something that's really going to help you develop brain cells. And if you're smoking, there's lots of reasons to block that out. So it is really a major risk factor in cognitive decline. But if you do have a chance to quit, it has been shown that if you quit, you actually decrease your risk after a certain window of time. It doesn't take very long to kind of come back down to the normal risk. It's basically, if you stop smoking by midlife and you smoked less than half a pack a day, the risk of dementia, if you manage to stop, is similar to people who've never smoked. But if you've smoked a lot, obviously it creates some pretty big risk. I think about 25% of people who smoked between 50 and 60 already had some sort of dementia, including probably 5% of the 25% had Alzheimer's. So it's a huge risk, especially if you've got 2 packs of cigarettes a day at midlife. So if you need help with that, you know where I am. Now, also taking care of your heart and cardiovascular system improves your brain. So if you have some other cardiovascular risk, like obesity or high blood pressure or diabetes, you're going to negatively impact the cardiovascular system and really increase your risk of stroke. Obviously, a healthy diet is going to be key to creating heart protection, and also regular exercise like we talked about. And if you're worried about your blood pressure, I mean, really what you want is you want your blood pressure to be 120/80 or less. That top number just indicates how much pressure your blood's exerting against your artery walls when your heart beats. And so this is why this is kind of the more crucial number, because it's showing you the maximum pressure that you can force into your vessels. And if you have a little bit of weakness in blood vessels, or you have the propensity for clot, this is where this starts to become a bit of a risk. So if those issues are part of your own current group of symptoms, that's something helping to calm that down will definitely decrease your risk of dementia. Now, again, in adults, just like in kids, we have to be really careful about safety. If you injure the adult brain, it really creates a big problem. So for all intents and purposes, wear a seatbelt, use a helmet, take steps to prevent falls. If you already know you're a little bit, sketchy on balance, put some safeguards in place, even if they're only temporary while you figure out what's going on. Inactivity is a huge common cause of reduced balance and coordination and flexibility. So you can always start with something easy exercise-wise, maybe some gentle yoga, low impact activity where you're not moving around a lot, or where it's floor-based or chair-based. And if you have poor vision, get your eyes checked. It's amazing how many people trip over things and fall. So just simple modifications. Now, you're also going to want to sleep. Not getting enough sleep really does result in problems with memory and thinking. And you can have insomnia for many things, from allergies, from pain, asthma. And so you want to actually go back. If you have difficulties with sleep, remember, we've talked all about these in a hour-long lecture dedicated to sleep last year. And so if sleep is part of the problem, and again, you're worried about dementia, or you think that it's affecting your memory, you can totally start there. There's an hour's worth of explanation about how to improve your sleep. Now, mental health and stress is another big factor. There's studies that report an association between depression and an increased risk of cognitive decline. There's quite an association, and there's growing evidence that the timing of depression can be important as well. So if you have earlier life depression, that's consistently shown to be associated with a twofold or greater increase in the risk of dementia. Studies in late life depression are more conflicting. The majority support an association, but the nature of it is unclear. So it's probably linking, based on vascular disease, alterations in like the glucocorticoids coming out of your adrenals, increased deposition of the beta amyloid plaques can happen under stress. You can get more inflammatory changes. You can get deficits of nerve growth factors. So anytime we have a chance to talk about your depression or your stresses, managing your stressors, you will decrease your risk of dementia. So physical activity, really important. Yoga. Actually, there was a study that showed in people 55 and older, they did a 12-week hour-long Kundalini yoga class with Kriya meditation, which is chanting, for 20 minutes every day. And they found that all participants really increased verbal memory skills, ability to navigate and remember locations, a lot more memory enhancement, decrease in anxiety and depression. So there's some easy kind of global things. You can kind of hit a bunch of birds with one stone if you don't mind yoga. Even meditation practice, simple mind-body therapies, improve cognitive function, sleep and mood and quality of life. Essential oils and aromatherapy can have a really positive impact on dementia, and it's probably because it improves depression and stress. So things like lavender and orange in the evening, and rosemary and lemon in the morning. They did an experiment that showed that actually showed significant improvement in scores for Alzheimer's disease reduction, just using essential oils. Super simple. Now, obviously, at the moment, we can't be super socially engaged, but once you can be, volunteering actually has a huge impact on cognitive problems. This is a University of Calgary psych study. It was published in a journal not too long ago, and it studied Swedish citizens that retired in 2010 over the first 5 years of their retirement. And they were divided into 3 groups based on how they did volunteer work. So one group had individuals that always volunteered at least an hour a week. The second group was kind of more sporadic. And the third group who just basically never volunteered. And they assessed them about 3 or 4 times over the years. And they found that people who did volunteer work for an hour a week on a regular basis were 2.5 times less likely to develop dementia than the seniors who didn't volunteer. I mean, that's a huge thing. And all people did was got out of the house for an hour. Now, volunteer work in the study was basically things that people did out of their free will for no money, and that were benefiting somebody who was not in the core family. So they were helping out at churches or schools or libraries or some sort of charity organization. So there you go. You can just volunteer and reduce your risk of dementia. And like I was saying before, challenging yourself with new things is extremely important, not just in education, but in skills. So you can work in specific kind of puzzles, and it's not just about like puzzles that are like crossword puzzles. It's more like learning new skills or increasing speed at skills. And now there's a bunch of apps and stuff that will do that for you. I really like Elevate. That's the one that I use a lot. And it's like word games and math games. And they're all kind of speed-based. So it kind of forces you to do it quickly. And it keeps track of your scores, sees how good you are at it over the long haul. And I don't know how much research has been done over with every app type, but there's definitely certain novel app types that are improving skill sets over time. Nutrition, obviously a huge one. You know, brain food, in essence. And I just want to start here also by reminding you about water. And this is a huge issue in Alberta. It creates big problems. If you dehydrate your brain by 2%, you're in a coma. No word of a lie. So your body's going to go through big attempts to try and keep as much fluid and juice in your brain as humanly possible. But if you refuse to drink water, eventually that's going to come back to bite you. And you can create big changes in consciousness, like I said, with very small movements. So I know I reiterate this every time, but drinking fluids is extremely important. Now, obviously, we've talked about in many lectures all the ways that food has an impact. And of course, food has an impact here as well. There was a great talk by Dean Ornish. He showed that more brain cells are produced when you eat, drumroll please, chocolate, the real thing. So you can eat chocolate, tea, like all forms of tea, blueberries. If you have a moderate intake of alcohol, it improves your circulation and decreases your dementia risk. And, you know, brain cells are decreased if you have saturated fat, if you have sugar, if you have nicotine, if you're using things like opiates or obviously cocaine we've talked about. If you have a lot of alcohol, like you have an alcohol problem, then it does tend to kill brain cells, and chronic stress, like we talked about. So eating a well-balanced diet, you know, really creates a big improvement. And, you know, there's a diet that's actually a variation on the Mediterranean diet. It's called the MIND diet. So it actually stands for Mediterranean Intervention for Neurodegenerative Delay. Say that 6 times fast. But, you know, in essence, it's very similar to what we've talked about before. And we've showed you like what is the optimal plate, where there's a bunch of leafy green vegetables, lots of other vegetables, berries twice a week. They were using whole grains, 3 servings a day. Incidentally, that's not whole grain bread as the way that we think about it. It's actually like cooked whole grains in some context. Eating fish, 1 serving a week at least. Poultry, 2 servings a week. Beans, 3. Nuts, 5, especially walnuts. Walnuts are brilliant. And in this particular diet, they also had wine at a glass per day, which I vote for, and olive oil. And so they're basically limiting red meat and sweets and cheese. They're limiting butter and margarine and fast and fried food. So if you follow a Mediterranean diet, you thicken your cortical brain regions. So all those cells in the gray matter plump up. And if you follow a nice diet, you'll get a lower glucose metabolism and a higher level of beta amyloid being reversed. So if you, after an average of 4.5 years, if you adhere to a diet similar to that, there was a study that showed that over half of people had reduced their rate of Alzheimer's disease compared to those who didn't follow something similar. So very nice data and evidence for that. And there's also good evidence for using certain kinds of supplements. I didn't list the supplements first, and I'm always listing them last because really there's so many things that have such a bigger impact than supplements. But obviously, fish oils are going to have an impact that you really need EPA and DHA. That's in fish oil or in algae. So you have to find some source of that, whether or not you're a fish eater or not. Alpha lipoic acid is very useful in decreasing dementia risk. It's great as a preventative, easy to find, doesn't take very much of a dose, maybe 500 milligrams. Curcumin complexes, like the extract from turmeric, that does improve memory and attention, probably because it's having an impact on inflammation. CoQ10 improves learning and memory and cognitive performance. That's something that we often give in cardiovascular disease as well. And it doesn't take very much of that either. It's usually about 200 milligrams. If you have an injured brain, like you've had a traumatic brain injury, or you already know that you have the beginnings of a dementia, then there's a couple of things that are used, like phosphatidylserine. That's actually a cell membrane component. It's very common in the body, but using extra seems to help improve Alzheimer's rates. It also curbs depression and helps regulate mood independently. NAC, we've talked about that in the terms of COVID in the last year. Carnitine, that will actually repair neuron damage. It's basically something that improves your metabolism at the electron transport chain in your mitochondria. So you can really prevent age-related brain decline if you have enough acetyl L-carnitine going in. Certain metabolic types really benefit from that. We also see huperzine A, that's from Chinese club moss. It is used in Chinese medicine for memory problems, and it's one of the things that's in my brain memory formula, if you've ever heard of that or you've ever taken it from the dispensary. There's other molecules like vinpocetine. That's a compound from periwinkle that really boosts brain flow. It's similar to ginkgo biloba in a way. So ginkgo actually increases blood flow to your brain. And so if you have vascular issues, increasing your brain flow is a good idea. There's also resveratrol. This is the reason that the berries are always on the diet list. And potentially also you can use some of the adaptogens, and you'll remember that we did a whole lecture on adaptogens for stress just a few lectures ago. So if that's part of something that's a big risk factor for you, you're going to want to go back and maybe reevaluate in the context of dementia. So that was a very packed bunch of information. And so, like I said, now's the test. Just kidding. There's no test. So thank you for taking the time to join me today. I'm going to always be here if you are wanting to create a better brain health journey.
Thanks for watching. I love to connect to my patient community to inform and inspire, and I hope you'll join us again in the near future. Don't forget to check out whole-life-medicine.com for more webinars and events.